All right, it's pictures of kids in the hospital this time of year that really kind of tug at the heartstrings just a little bit. And every year, thousands of kids will undergo some form of surgery, whether it's for a birth defect, an illness, or other conditions. And that's why we got a guest today for our medical interview. We've got Dr. Jeff Damer. Thank you very much for being here, pediatric surgeon. I'm older than you. You don't remember. You probably read in your books. Times have changed medically and just protocol-wise. When I was a kid, you couldn't even get past the waiting room to get upstairs to see someone who was sick. But the only time you did go upstairs is when you had your tonsils out. And it seems like we went out kind of like an assembly line. Right. That was kind of a rite of a passage when we were a kid. Times are indeed changing. And so for kids who are, parents who are going through this whole hospital ordeal with their kids for the very first time, give us some tips as to what we really should be worried about.
Well, I think one of the things that we've really tried to stress here at NHRMC is having a process that's kid-friendly and family-friendly. Actually, something exciting coming in the next year is we're going to be completely revamping the whole perioperative experience for children. Having a separate area in the pre-op setting where there's toys and games and things to keep kids comfortable, to having a more kid-friendly operating room with stickers and things on the wall, and then having an area post-op where families and kids can get reunited as quickly as possible as they're emerging from anesthesia. So trying to keep the family together and have an environment that's friendly and exciting and even fun for the kids to be in is something that's really important.
And so as a parent, what should I do before that step finally happens?
Well, I think, you know, we have a great mechanism to get kids into our clinics. The clinics are kid-friendly as well. You know, our perioperative information that we give families about what to expect and where to be and when to be is fairly comprehensive, and so we want to take as much of the work off the families as we possibly can.
I remember every kid 5 to 6 years old in my generation had their tonsils out. What's the #1 surgery right now for young kids?
For a pediatric general surgeon, probably appendicitis is one of the most common things we see, so laparoscopic appendectomy is probably the top procedure that we do, but there's a wide range of teenagers down to even babies in the NICU that are just a few minutes or hours old that can need urgent surgical intervention.
And when we talk about the appendix, is that emergency surgery or is that planned surgery?
It's not necessarily planned, but it's not emergency in the sense that if I see a kid in the emergency room with appendicitis, we don't have to go to the OR right away. They get antibiotics and IV fluids, and then we do it usually within 12 to 24 hours.
And so big changes there in the hospital, evolving every single day.
That's right. It's an exciting place to be.
To make kids well and to get the fear out of kids as well when they go to the hospital.
Well, that's a big part of it, is making sure that the kids are comfortable. If the parents see the kids laughing and smiling, even though they're about to undergo a scary procedure for them, that makes a big deal to put the family at ease.
Thank you for your time, Doctor.
My pleasure.
Happy holidays to you.
Thanks, you too.